Good morning and welcome to Ask the Expert. I'm Joe Taylor. This morning, another in the ongoing series of programs presented by the Northwest Regional Key Program for Quality Early Learning. The program, through the Northwest Institute of Research, oversees a grant from the Office of Child Development and Early Learning at the Pennsylvania Department of Human Services and the Department of Education. The goal of the program is to improve the outcomes for young children as they prepare for school. John Poza from the Pennsylvania Key is the host of the program and is with us throughout the series. And John, who do we have on the phone line this morning?
Good morning, Joe. This morning we have Marnie Aylesworth, who is the executive director of the Pennsylvania Key, and she has worked in the field of early childhood education for over 25 years. Marnie has been with the PA Key for 8 years, working to support early childhood programs like Pennsylvania Pre-K Counts and the Head Start State Supplemental Program. Welcome to the program, Marnie.
Thank you so much for having me.
Yeah, great to have you. Hey, for those parents and families that listen to the show that may be unfamiliar with the Pennsylvania Key, can you provide an overview of the organization and its mission?
Sure. So the Pennsylvania Key was actually established and created as a support organization for the Office of Child Development and Early Learning, which we call OCDEL,
right,
in familiar terms. And the main goal of the organization was to be able to implement and monitor programs that were developed as a result of OCDEL's policies and their priorities. So essentially, we're the implementation arm of OCDEL to be able to help set up some programming. So you've named some examples, like Pennsylvania's Pre-K Counts program. We also oversee the Early Head Start Child Care Partnership program for the Office of Child Development, as well as home visiting programs. In addition to that, we coordinate the ongoing professional development for early childhood professionals across the state and basically supply them with training opportunities across the state that align with the office's policies around early childhood. In terms of quality, we help with assessment of classroom environments, and we also support the early childhood mental health consultation program so that we're supporting young children in their social and emotional development.
Right. So as executive director of the PA Key, what are some of the main goals and initiatives that you're currently working on?
Well, our first and foremost goal is always to support OCDEL's vision of a streamlined access for quality early learning experiences for families and children. And in doing so, as they develop policies around access for children and finding really great programming, we support that. And then our other mission is really to support the workforce in early childhood. So I mentioned professional development. We have a registry platform, I guess I'll call, to be able to coordinate professional development opportunities, both continuing education and initial education of young teachers across the state. So the registry is one example of that. We've got a brand new website that supports the providers in streamlining access as well.
From a parent's perspective, what effect does the work that you do at PA Key have on their children and their families? If you were to explain to a parent in terms that as civilians they can understand, why is what you do important to them?
Well, that's a great question, and our staff don't actually directly work with children. Our job is to support those who do.
Right, I understand that, yeah.
Yeah. So essentially, what I can use one example of a preschool specialist. The preschool specialist job is to go out to a child, let's use a child care as an example, who has pre-K counts programming. That pre-K counts programming is a free pre-K program for families who fit into a certain income category, and if their child is 3 or 4, they qualify. That child's experience is going to be we're going to consider it quality with a certain number of criteria being met. So our specialists are out there ensuring that teachers have qualifications that we hold them to, that the program is engaged in the state's quality system, and that they are using curriculum that is aligned with state's early learning standards. So we're essentially monitoring and ensuring that every child's experience in pre-K counts is a quality one that's going to lead to better experiences as they get into the K-12 world.
Absolutely. Now, Marnie, I read in your bio that indicated that you personally subscribe to a shared leadership philosophy. How is that implemented at the PA Key?
Well, we work really hard to leverage the strengths of every staff person here at the Pennsylvania Key. It's my belief that if we're going to positively impact teachers who are ultimately trying to positively impact children, then we have to be a cohesive team, and we have to be able to give the best possible service to the child care providers and educators across the state. So every department has their strengths, every person has their strengths, and we leverage those regardless of their job title. So when staff can contribute to the team's mission in a way that is meaningful for them, they tend to be happier, they tend to be more productive, and there are no wrong answers. Every idea is considered, and people are encouraged to take risks, which leads to really innovative ideas that ultimately trickle down to the teachers, the providers, the families, and the children.
Absolutely. And, you know, one of the words that you hear so often in that philosophy is empowerment.
Yes, I love that
yeah,
word.
Exactly. I do too. And, you know, it can be implied in every field, regardless of what your career interest is, in that knowing that you have your opinion and your ideas and input is definitely valued, and you're encouraged to do so. I think that's basically pretty much what, myself included with the PA Key, that's kind of what we're encouraged to do. Isn't that correct?
Absolutely. And so I can only affect a certain level of people in terms of the PA Key complement, which is about 70 staff across the state. But my hope is that mentality then feeds into how they work with child care staff, teachers, and providers, and then feeds into how those teachers work with families, so that we're all empowering one another to bring the best possible outcomes for kiddos.
Absolutely. Well, I wanted to ask you, currently there's an upcoming proposed model for changes more in the infrastructure of several quality Office of Child Development programs under the state, under what's been called Early Learning Resource Centers. And these centers are to be operated in 19 regions across the state beginning July 1st with the next fiscal year. What can you tell us about this, and how will this improve services to families and children?
Sure. So I believe the hope is, and this is really one of those initiatives that is completely pushed out of the Office of Child Development and Early Learning. Our role is really just to support the implementation and transition of that.
Right.
But the end goal for families here is to make things easier to get to, that when you go in, so currently, the way the system is currently set up, if a family wants to get subsidy or support in paying for child care, they have to go to there are over 40 different county offices across the state.
Right.
And if they want to find a quality child care program that's in the STARS system, well, that's housed in a different entity right now. The goal of the ELRCs is to basically bring those services under one house, so that the idea of getting some help paying for child care and also having that child care be quality is all under the same infrastructure. And families could essentially go to this one-stop shop and find out, one, where they can get financial support to pay for the child care, but also what does quality look like, where is quality in my community, what other resources for families are around here that I need for my child or my children. And so it's really completely focused on the family's experience, and that was the intent behind it.
Right. And also, isn't the certification system for monitoring the health and safety environments of child cares kind of part of this infrastructure as well? And from the standpoint of even those who want to become or are interested in becoming a child care provider, isn't that also to be included under this infrastructure?
So they're closely intermingled. The certification offices themselves, those licensing offices,
right,
are in different buildings or different locations from these proposed ELRC places. But that being said, when a provider decides to become a child care, let's say, they get a license with the Department with DHS. Then they automatically become a Star 1, which is putting them into the quality track.
Right.
And then when that happens, yes, then they automatically fall into the ELRC category. So it is all very closely linked, and that is a change where you used to have providers who would not be in STARS but still be licensed. Now, once you're licensed, you become a STARS facility and you become part of the quality improvement process.
I'd like to take this to a different level here, because there's so many things that are changing in our country. But I was wondering, how much of what is done at the state level regarding advancing early childhood learning is affected by changes in philosophy or policy, and also funding at the national level?
That's a great question, Joe. I think I would say every administration probably has its own slant on it, both federally and at the state level. Right now, though, I believe there's quite a bit of influence in terms of, I can only speak from my experiences with the two offices federally that we work with, which is the Office of Child Care and the Office of Head Start. And over the last 5 years or so, the Office of Head Start and Child Care have worked very closely at the federal level to combine resources, leverage resources under both houses to be able to provide consistent early childhood expectations. And Pennsylvania has followed suit. That the mere fact that we in Pennsylvania have an Office of Child Development and Early Learning that is really encompassing both DHS and Department of Ed is a perfect example of that. And so I know Pennsylvania and Octal have been modeling many of the philosophies that the federal level have been doing over the last 5 years.
Yeah. You know, Marnie, your research, of course, you're working on your PhD as you know, and your current research focuses on the impact mindfulness can have on an early childhood educator's health and well-being, as well as on their ability to successfully work and teach in a pre-kindergarten classroom. You specifically have found that this is mainly prevalent in communities with poverty. And how so?
Well, so it's not necessarily that it's prevalent in communities where there's poverty. What the focus of the research was in those targeted communities for a reason. Mindfulness practice has the potential to build any person's capacity for compassion and self-reflection.
Right.
And there's been some recent research. Walter Gilliam came out recently with some research around implicit bias. And we know from that research that sometimes implicit bias can cause an increase in, and maybe a contributing factor to, the increase in suspension and expulsion of children in pre-K programs. The rate of expulsion in pre-K programs is disproportionately higher than that of the K-12 world.
Right.
And what he was finding was, in fact, it's extremely high in terms of pre-K African-American boys. And so when I entered into my research, I specifically chose a community that I would hopefully see some positive impacts from mindfulness and investigate some of that implicit bias.
Right.
And, I'm hoping to find is that we'll show that mindfulness can impact a teacher's perceptions, because it really comes down to, and that's a lot of what Walter Gilliam's research focused on, was a teacher's perception of a child and what they expected their behaviors to be. In addition to that, I feel very strongly that teachers are under extreme duress right now, and that's not true of just pre-K and preschool teachers. It's true of educators across the board.
Absolutely.
I particularly am focused on pre-K, but they're not only dealing with extremely low pay and extremely high levels of stress in the classroom. They're working with children who may have experienced trauma or poverty and other factors in their own lives. And so there's a lot on them. And we don't really, as adults, we aren't raised to really think about our own social and emotional health. And if you can't take care of yourself, it's very hard to take care of somebody else, especially a little person who is still working out how to even manage their emotions. So I'm hoping to find that being able to use this practice of mindfulness is another tool in an educator's toolbox to help them impact their classroom climate.
Could we get a definition of, I believe I know what you're talking about, but for our casual listener, mindfulness?
Oh, sure.
Yeah.
Essentially, John Kabat-Zinn has his own definition, and there are iterations of it, but essentially it's being able to take a step back, pay close attention to one particular thing without judgment, and really just focus. So if I were to give you like a real-life example, some people compare it to meditation, although it doesn't necessarily have to be meditation. It could be that you're coloring a mandala picture, and you're very focused on each and every section that you're coloring. It could be that you're just sitting, closing your eyes, and taking a few breaths in through your nose and out through your mouth. And there are hundreds of ways to practice that, both formally and informally.
Yes, and I remember at some of the meetings we've had at the PA Key, Marnie got us to practice this mindfulness in these deep breathing exercises. And yeah, I definitely, when you participate in the exercise, you more fully understand exactly how the intent of it. We're talking with Marnie Aylesworth, Executive Director of the Pennsylvania Key. And Marnie, I know we talked about in your research, and you mentioned about the problem with expulsion and suspension with preschools. There's a new protocol now, or at least advisory protocol for child care providers in dealing with preschool children who they're having difficulties with. And tell us a little bit about the OCDEL stance and the position on how child care providers are to approach working with these difficult children so that we can keep them, enrolled without having to expel or suspend them.
Sure. So this is another example, going back to Joe's question about the alignment between the federal initiatives and the state initiatives. The federal offices initially, and Head Start initially rolled out a policy around suspension and expulsion. It was prompted by Walter Gilliam's research. Mm-hmm. And when that happened, Pennsylvania elected to create their own policies. And those policies are basically saying, these are the expectations, these are the steps we hope each child care provider will follow in order to reduce or eliminate the likelihood of expelling or suspending a child, because there are serious implications for a child. A child who is expelled in pre-K is 10 times more likely to be expelled again and again throughout their educational career. So it's something we want to really kind of get a hold of when they're in the early grades. And so it's a very, very intricate issue. And there is no one Band-Aid, and there's never one reason why a child is being expelled. But some of the reasons that we know are either, as I mentioned earlier, implicit bias, a misunderstanding of culture. It could be that there are educators who have they're not familiar with developmentally appropriate practice and developmentally appropriate behaviors for children. It could be the classroom environment is set up in such a way that it's not conducive for children. So there's so many different things it could be, and the policies were designed to provide a resource to say, do you have a policy? What's that policy look like? And then do you do these things? Are your teachers trained in this, this, and this? Are your families informed of your policies? And kind of walking them through what we know are some of best practices to begin to avoid those suspensions and the expulsions.
Yeah.
The other thing we're finding, John, is that families are not aware of inclusion practices. So I started realizing many years ago, we moved from a specialized setting for children with special needs into a inclusive setting where we include every child in every classroom, and we work to meet their needs within that setting so that they're in a typically developing classroom. Well, that we taught the educators about that, and we taught the field about that, but we didn't really talk to the parents of typically developing children about those practices and what that means for their kiddo when they have a child who's one of their classmates who may be in this setting because we're including them in a typical environment, but there are challenges to that. And what does that look like, and what does that mean, and what are the rules around IDEA regulation that I have to keep this child, but I need to meet his needs, and I also need to meet the needs of the other children. So there's so many layers to this issue that the policy is really just the start, and it hopefully will drive supports and resources that we can put out to educators to start to work on that.
And as you know and can appreciate, there's nothing more beautiful than when you see a truly inclusive classroom, early childhood classroom, where every child is appreciated for the values they bring to that classroom, to where the other children who are in that classroom with those who have maybe some developmental needs are so supportive of one another. It's a beautiful thing when you see that actually taking place in a classroom.
Absolutely.
Yeah.
I agree 100%. It's wonderful. It's shared leadership in this truest form.
Yeah, absolutely. We only have about a minute left, Marnie. Tell us what's new and exciting that you can see that the PAK is going to be involved in down the road.
Well, I think our big focus, for me at least, is really around early childhood mental health consultation. We are finding, for some of the reasons we've been talking about this morning, that we're just finding so many kids across Pennsylvania who are experiencing trauma, and the opioid crisis is deeply impacting families in this state. And so we're really working to find some innovative ways to be able to fund and support any efforts we can around early childhood mental health.
Yeah, involves the entire community, the entire state, the country for that matter.
Yeah, that's true.
So important. Hey, Marnie, thank you so much. The time has just flown, but you had a wealth of information to share with our listeners, and I really appreciate it, and we'll hope to have you back again.
Well, thank you both very much. It was a pleasure being with you.
Yeah, thanks again.
Very interesting program. And that's our program for today. We'll be back in 2 weeks at this same time. In the meantime, you can go online to learn more.